This is Canada's annual Global Health Conference, hosted each year by the Canadian Society for International Health. It's a little different this year in that it's being hosted virtually. Usually this takes place in the nation's capital, where we can all gather together in Ottawa. So I know it's been a bit of a different experience this year, but we're making do with what we can right now. One good thing about this virtual experience is that we've been able to pull in speakers from around the world who wouldn't otherwise have the opportunity to participate. So I'd say that's a silver lining despite the current crisis taking place right now. For those of you who don't know me, my name is Robyn Christine Waite. I am the Policy and Advocacy Manager at Results Canada, and I'm my swag very proudly today. Today's session is really about understanding how COVID-19 is impacting the tuberculosis epidemic. And for those of you who do not know, TB is a communicable disease that is a major cause of ill health. It is one of the top 10 causes of death worldwide, right up there alongside car road accidents. And it is the leading cause of death from a single infectious agent, ranking above HIV and AIDS, and yes, even COVID-19. And at Results Canada, we really care about building the political will to end TB because it is a disease that is intimately associated with poverty and economic distress, vulnerability, marginalization, stigma, and discrimination are often faced by people affected by TB. So TB is treatable and curable. We have the tools to support all people with TB and to eradicate it off the face of the earth. What is lacking, however, is the investment of money and resource and political will and action, which is why I'm really honored to have the privilege of introducing you to Dr. Saurabh Rani today, who will be moderating this session. Saurabh is a survivor of drug-resistant tuberculosis, and he's joining us live from Mumbai, India. He is a fierce and effective advocate for the cause who stirs people like me, and hopefully today you, to action. And boy, now more than ever, do we need to be active. As we learn more about today, the impact of COVID-19 on people with TB is proving to be devastating. That being said, moments of crisis can be turned into moments of positive social change. And we will explore how communities are mobilizing right now to find hope and push forward solutions today. Okay, Saurabh, without any further ado, over to you as our keynote speaker and moderator.
Thank you so much, Robyn. It's great to be here and have this opportunity to talk. And I'm, one of the upsides of being in a virtual world is that I get to meet and talk to amazing people. As you rightly mentioned, we are sort of living in tough times, and it's true that for patients, especially TB patients, they're going through a really, really rough patch right now. But it isn't COVID that has caused it, right? It's just merely like made it even worse. The public health system, as we know it, has been broken for a while now. And I can dial back to 2013 when I got diagnosed, and it took more than 6 months for the doctors to just figure out what my right diagnosis was. And after 6 months, they figured out it was XDR-TB, and that was just the start. It was a 3-year-long excruciating treatment with side effects, ranging from partial blindness, loss of sensation, thyroid problems. And I was still one of the lucky ones, who had access to healthcare. Being from the medical background, I had enough knowledge to navigate the system. And in this long fight, I lost the lower half of my lungs, but I managed to survive. I got through this roller coaster. But right now, the situation is heartbreaking. Patients are living under anxiety, not knowing how COVID might affect them, especially given their immunocompromised condition. And we know that people sort of with TB and TB survivors are at an increased risk of COVID. Right now, people are having difficulty accessing their services, getting their medication, and health resources are being diverted away from TB to respond to the current crisis. And due to the stigma, people often find their mental peace by distracting or engaging in simple outdoor activities like going for a walk or something. Lockdowns and fear of this disease has, however, made these few brief moments of reprieve very difficult for patients. And talking about drug-resistant patients, it's even tougher because they need to take injectables and they are usually administered by a healthcare professional, right? So given the current sort of distracted and limited bandwidth that the system has, it's pure nightmare for them. I mean, the only reason I could get diagnosed and treated back in the day was because of the ease of access, availability of specialists, and the health system having some kind of bandwidth to conduct emergency procedures. If I were to imagine myself going through the same in today's time, I'm not sure if I would have the same treatment outcome of survival. And this isn't just what I feel, right? But the survivor community as a whole sort of recognizes this. There are heightened challenges that the COVID pandemic presents for people living with TB. And I'd love to invite you to sort of shed more light on this topic and go ahead and introduce the speakers for the day.
Thanks so much, Saurabh. And we're really lucky today to be joined by Dr. Dina Fisher and Luan Vaughn, based in Vietnam, to tell and share their experience of how the pandemic is impacting the TB work that they're doing. So they're going to be on our panel today, which is going to be moderated by Saurabh. And before we dive into that, I want to give them each the opportunity to introduce themselves. So maybe, Dina, we can start with you, and then we'll pass it over to Luan. Please introduce yourselves.
Hi, I'm Dr. Dina Fisher. I'm the medical director at the Calgary Tuberculosis Clinic in Alberta, and I'm the co-chair of Stop TB Canada with Dr. Elizabeth Ray, who couldn't be with us today. Thanks so much, Robyn and Saurabh.
Hi, everyone. My name is Luan Waite. I'm the chairman and the project director of Friends for International TB Relief, based out of Vietnam, where, as you probably all know, that Vietnam is actually one of the countries that hasn't had as bad of an impact of COVID itself, but we'll share more about the situation and how that affected our work in a minute. And specifically, what does our work comprise? It's basically providing active case finding and patient-centered care, social protection, but also increased interventions in TB infection treatment by engaging not just the communities, but also other stakeholders, particularly healthcare providers that are not right now in the TB networks. So just trying to do our best in supporting the Vietnamese TB program and pushing towards ending TB by 2030 or whenever, as best as we can. Thanks for having me on this panel. Thank you, guys.
Thank you for coming. So I'm just going to share my screen for a moment to tell you a little bit more about Stop TB Canada and then also TB Reach, because Luan and his team are grant recipients of TB Reach, which is a Canadian-funded initiative working to end TB. So let me share my screen. 1 second. All right. Okay, so we at Stop TB Canada are really proud because we've been working hard over the past few months to really rebuild and relaunch the network. Results Canada has been kind enough to dedicate some of my time and resource to supporting from an admin and communications perspective. So I'm super proud to be one of the secretariats of the Stop TB Canada network. We recently relaunched the website, which I invite you to visit. It's stoptbcanada.com. This is meant to be a resource for the sector. So for example, if you go to the Learn page, we have all of the key critical global and national focused resources that you can take a look at to learn more about tuberculosis at home and abroad. We can also engage our community by having them add resources as well. So I just invite you to go check this out, engage with it, add to it, and participate in our community. We also relaunched our Twitter account at Stop TB Canada. So we'd be really grateful if you followed us today, and if you want to do some live tweeting, we'd love it. Okay, next over to learning a little bit more about TB Reach. So as I said, TB Reach, it's an initiative housed within the global Stop TB partnership that is dedicating to mobilizing communities on the ground to engage with innovative methods to ending tuberculosis, mainly by finding people with tuberculosis and making sure they get on treatment so that they can recover from disease. So this mechanism, Canada was a founding donor of, and it is coming up for replenishment. So in the global health space, lots of different funding mechanisms exist, and they usually go through replenishment cycles. TB Reach is every 3 years, and they're coming up this month with a new need for financing in order to continue their important work. So the team kindly put together this video for us. Thanks so much for watching that. Really appreciate it. I think TB Reach is particularly important because it is a community-led response to ending the TB epidemic. So if we can mobilize resources for it, we're getting money into the hands of people on the ground. All right, so without any further delay, Saurabh, I'm going to pass it over to you to moderate a panel discussion with our awesome panelists today.
Thanks, Robyn. And thank you, Dr. Fisher and Luan, for your time and also for being with us here today. And I would really like to just jump into the Q&A session and ask you guys a few questions and get your insights on this. Before we do that, for the audience, a quick reminder that you can post your questions in the chat box and also write the name of the speaker in case you want to direct it to someone specific. And we can sort of pick it from there. So my first question to both the speakers is around the challenges that you're facing around TB care delivery, especially given the whole uncertainty caused by COVID-19. So the question would be, what are the top 3 challenges that you're facing due to this pandemic? And Dr. Fisher, we could hear from you first.
Sure, thanks so much. I think one of the big challenges we've noticed is our human resources and care team really being pulled away for other work specifically related to COVID. So public health nurses have very specific training in contact tracing. So we've lost a lot of our nurses to COVID contact tracing, which I think is important for COVID, but we lose our access to excellently trained public health nurses when they move on to a different location. So that's been a real challenge for us, for certain. With the lack of being able to go to work when we have symptoms with COVID-19, we're a small program. We've lost a lot of our access to our public health nurses. So there's certainly been times when we can't do our daily work because we don't have enough clerical staff, nursing staff, or physician staff to do our work. So that's been a challenge. I do think our staff is facing burnout. COVID's been going on since March. We've had a lot of changes we've had to implement. And I think people are getting tired and fatigued. I'd say change fatigue is definitely difficult to manage. Certainly working in Canada, we've been okay in the summer with having our patients wait outside our office because we have to physically distance from each other. But as we head into winter and snow in Alberta, that's not really an option. And we're really struggling with physical space constraints. And budgetary restraints are a difficult problem for us as well. We want to make changes to our infrastructure that costs money. And from a budgetary standpoint, specifically in Alberta, we're struggling currently. So I think those are all significant challenges we've been facing since March for COVID-19.
No, thank you so much, Dr. Fisher. That was really insightful, and I think everyone is just looking forward to see how and what we can do to solve for these challenges. I would love to hear from you, Mr. Luan. Could you share experiences regarding few challenges, top challenges that you faced?
Of course, thanks, Saurabh and Robyn. I think the 3 challenges, if I had to think of 3 right now, they would fall into the categories of first, health seeking of people affected by TB. Secondly, would be operational challenges with our activities, TB Reach funded and otherwise, in finding more cases and providing the support that is needed. And the third one would be just obviously financial challenges for our own organization. With respect to health seeking, if I may go into a little bit more detail for you guys, as you know, Vietnam has less than 1,200 cases and less than 40 mortalities due to COVID, which means that as a public health response, the country has done quite well. However, what it also meant is that a lot of people were actually quite worried if they were found with influenza-like illness or symptoms that might might mirror COVID or TB, and so would actually not go to seek health, and then would deal with it on their own. And I think this was seen by the TB program that has had a 10 to 33% case notification reduction in case notifications this year, which is quite scary, because if people with TB do not seek health, they can't get the care that they need, and the result of that we all know is well documented. The second is the operational challenge, And specifically, our organization does a lot of different strategies, but two of the key strategies that were really severely affected. The first one is what we call sweep, where we organize community screening events deep in the communes and hard to reach areas like islands and mountainous areas and so forth, where we bring people together, we mobilize people and conduct multi-day health screening campaigns, not just for TB, but also LTBI and then some of the common non-NCDs. And that obviously, because of the lack of health seeking, but also because of restrictions imposed by the government, has not been possible at all. And so that came to a screeching halt over the last, I want to say, 9 months. The other model that we employ in terms of operations is to engage private providers and just healthcare providers outside of the TB network. And even there, where you would think people would seek health, but even private providers that used to work in TB said that they would just close down their shop, because had somebody shown up with influenza like TB-related symptoms or COVID-like symptoms, the government might have shut their private practice down. And so those operational challenges actually presented quite a big hurdle for us to deal with over the year. And as you can't do any operational work, come the financial challenges. Top line, when you can't raise funds for TB anymore, costs where you have the fixed costs, but you can't you can't cover because you can't implement your activities. And then obviously also the working capital impact, as you delay your implementation, you can't get the next tranche of funding, even though you still have to pay salaries. And I think those health seeking operational challenges and financial challenges were some of the key issues that we've been facing over the last 10 months.
Oh, thank you. Thank you so much, Luan, for sharing these experiences with us. I think what Vietnam's done is really, really impressive, with controlling the caseload, and particularly the approach and the interventions that you just mentioned. They seem to be very, very valuable. I completely understand the challenges that you're facing, because, in India, we're facing more or less the same thing, just that the cases here are extremely high. This sort of naturally leads me to my next question around resolving these issues, right? So, Luan, according to you, what resources or solutions, are needed to ensure, continued provision of quality TB care, or how can we mitigate the impact that COVID-19 pandemic or the lockdown is having on TB services?
Sure, and when I think about provision of quality TB care, it's not just medical care, right? It's not just the drugs and the diagnostics, but the comprehensive package. And we saw that in the video from Stop TB Partnership earlier, one of the few mechanisms that also emphasizes the biosocial support, or addressing the social determinants of health. And one of the first things that I do think that came to mind when you said quality TB care, it's actually to think about in times of COVID, social protection and mental health of patients, of people, of the key vulnerable populations that are commonly affected by TB. When you have commonly informal workers that can't do the work that they used to do, selling lottery tickets on the street, cleaning or rack picking or whatever it is, and then lose their little livelihood that they already have, which obviously then feeds into the cycle of TB. The second, and with that said, obviously what you need, not just in terms of social protection, mental health support, is then also just better access to healthcare services in general, particularly at the lower levels. As we saw in Vietnam, as this happened, the lower primary care and providers and the informal care providers and so forth, they also all shut down, and people were pouring into the hospitals and so forth, and then that leads to an overloading, and actually hospitals then in Vietnam, the couple turned into hotspots. And I think that was kind of a big lesson. And we need to, because as these turned into hotspots, they then turned and pushed the care back down, and the lower levels weren't actually all that ready for that, not just to deal with TB, but all sorts of illnesses. And so one of the key solutions that I think they started to employ here was to use telehealth and like delivery services where people didn't have to leave their home anymore, expose themselves, or with TB could be sample collection and transport, and just remote diagnostics, chatting on a chat app That's what some of the doctors and some of the TB care providers here did, and I think that and now that we are aware that COVID for the time being is around to stay, I think the fourth kind of solution is to actually integrate COVID into TB type of services, whether it's screening, whether it's radiology and AI, or whether it's basically using platforms like Expert that can do both TB and COVID cartridges to just leverage the systems and the technologies that we have in order to do both, address both diseases with the same infrastructure. Over.
No, that was aptly put. It's really interesting, and we need to ensure that we do everything in our power to sort of make sure that patients are taken care of during these tough times, right? Thank you so much for sharing these thoughts. Dr. Fisher, we would love to hear your thoughts on the same question, right? What resources or solutions are needed to ensure continued provision of quality TB care, or how might we mitigate the impact that COVID-19 pandemic or the lockdown is causing right now?
I think we've used some of the same strategies that they've used in Vietnam. I think utilizing our virtual access for our patient population has been really important. I think it's trying to make our care more patient-centered. Certainly, we found as our severe restrictions lifted, a lot of people, as we've mentioned, have been concerned about health seeking or coming into our facility. So making sure that we're offering both a virtual appointment or a physical appointment, so we're matching what the patients want. We have access to social work, pharmacy, a really important multidisciplinary team. So setting up Zoom conferences with our patients so that we can provide that multidisciplinary support virtually, I think has been really helpful for us. And one of the things I think is really important is advocating for our patient population that doesn't have access to cell phones or computers, because they get stigmatized and they don't get the same access. So I think one of the things we're working on for the next few months is for our patient population who can't access that because they don't have the technology, is working to ensure that they do have the technology. And for me, certainly our working towards TB elimination, we have to be concentrating on our latent tuberculosis infection population in addition to our active TB cases. And one of the things I think we've really accomplished is streamlining that approach so it's not impacting people's work, it's not taking them away from work, but they can have one visit either virtually or in person, and then everything else is brought to them in their house. That has been really helpful for ensuring we can continue to provide latent tuberculosis infection care. And certainly we found when our site became overwhelmed that we should be relying on our partners outside of our specific city, especially when we provide virtual care. So we have the expertise in small parts of the province, but this can be provided virtually outside of our center. So asking for help outside of our geographic area, now that we're using our virtual technology more, has been really helpful during this time.
Thank you. Thank you so much, Dr. Fisher. I think this is something that everyone everywhere should be thinking about, right? Especially when patients do need these services and they need it sort of at the earliest. So thank you so much for sharing these thoughts with us. I'm just going to quickly move and take questions from the audience. And I think there is a question from Rachel, if I'm not wrong. Could we unmute? Rachel, could you unmute yourself and ask the question? I believe it's towards Luan.
Hi, can you hear me?
Yep, we can hear you.
Okay, I think actually Luan kind of answered my question already by talking about AI and other solutions, but as the global pandemic begins to settle down, as a vaccine comes into play, what lessons should the broader TB community take away from a successful response to COVID in Vietnam? So what components of the COVID response should be adopted by the TB community?
Yeah, thanks for the question. I actually think, aside from technology and strategies and tactics that we can employ, I think the response, or the public health response of Vietnam, was actually marked by a couple of really key factors from the top level down, actually, which was that the government of Vietnam was very decisive and swift in its action. They decided, as soon as they found out that there was a new pathogen traveled from China and then later from Korea, was actually shut down in January, so quite early in the year, and the government then also shut down schools in the third week of January, and then used their, obviously Vietnam has a strong unitary government, a strong let's say advocacy or propaganda machine, but use that to disseminate the message about washing hands, about wearing face masks, about not gathering in groups, and just pushing a unified message, sending a text message every day for several weeks through their national carriers to every person in the country, saying, please, please wash your hands, all these standard messages. And I think the decisiveness of this action, as well as the clear messaging that this is preventable, you can contain it, and we can thereby keep it under control and maybe even end it, is something that I think from a big picture can be translated very well to TB, because I think in the end, the symptoms are very similar. It's a respiratory infectious disease, and and while they're not perfectly the same, but there are a lot of factors that are concordant. Whereas an overall public health response, if the country would then turn around and say, we managed to control COVID, we want to do the same for TB, I think it would have a realistic chance to actually achieve NTB targets as per the WHO strategy. Over.
Thanks a lot, Ron. That was very helpful. I think they're doing something similar in other countries as well. In India, if you have to make a phone call, you can't get through a phone call without listening to 30 seconds of what you need to do for COVID. And I think that's very interesting. And it's in all languages. So thank you so much. I think that was very, very interesting. I think we have another question from Danielle. Can you just unmute yourself and ask a question?
Yeah, okay, good. So my question is, so as partners, whether it's health providers or working on the advocacy and policy side, how can we better collect, communicate, and use frontline data to sort of steer that towards investments, like in the global TB response? And frontline data from what we're gathering, like TB and the COVID-19 pandemic, like how can we leverage that data to have more investments?
Hey, Jenny, could you also tell us who you're directing the question to?
Oh, I'm sorry. That question was just for both panel, for everyone on the panel, actually. Yeah.
Oh, thank you. Dr. Fisher, would you like to go first?
Yeah, I think that's a great question. And one of the things we've noticed is, especially in a low endemic TB country like Canada, often the media messages why are we worried about tuberculosis? Does it even exist anymore? So certainly leveraging respiratory illness, COVID has done if we have to look at good things about COVID, people are interested in infectious respiratory illness. I think we should tack on tuberculosis as one of those infectious respiratory illnesses and use our data towards improving investment. I think that people, at least in Canada, it's a bit of a forgotten disease. People don't understand how prevalent it is in multiple other countries outside of North America. And so using this as a media opportunity, I think, is important. And I think that normalizing discussions about respiratory infections, I think, is important. Certainly with mask wearing, that's come up a lot. A lot of my patients feel destigmatized now when they go out wearing a mask because everybody has to wear a mask. So I think taking our frontline data, using it as an infectious respiratory illness, there's multiple we all should be thinking about, would be one opportunity that comes from COVID from the tuberculosis standpoint.
Thank you so much, Dr. Fisher. Luan?
Yeah, I fully agree with what Dr. Fisher just said. I think that, especially with regards to frontline data, there's some actually, and better data use in general. There's so many opportunities, not just and then we can, for advocacy, but also for awareness building, and to say to people that, for example, in Vietnam, a lot of, or in general, as I've seen in a lot of other countries, as TB doesn't affect everybody, it affects mainly the vulnerable populations, vulnerable groups. The others think that TB is over, and using just basic data to say that there are more deaths due to TB than road traffic accidents, or what I've been saying more recently, and that it's the case for Vietnam as well, almost double, or what I've been saying more recently. There's 13,000 deaths in Vietnam due to TB, and then we had 35 due to COVID, right? Or and even at the global level. But and that's for awareness building. But then using these data to actually also perhaps try to do more sophisticated health economic analyses to be able to put that into maybe policy briefs or things to again try to convince the stakeholders and domestic payers, but also international ones, I'll convince them of the value of actually trying to end TB the same and fight TB and end TB the same way that we're trying to do with COVID. And so I think, in short, data is, I think the word data is a key word that we should be using more often, and then using it at all levels. Not just with the policymakers, but then also or with the donors, but then also even with the communities and the individuals, to convince them that TB is still a problem, but we can end it if we can end it. If you get treated, you have a 90% cure rate, and things like that. You can always use these data to strengthen your argument.
Thanks, Lon. This statement reminds me of something that they use a lot in the AI world, which says that data is the new oil in some sense. So data is something that everyone's looking at right now. So great question. On this note, actually, I have a quick question for both of our speakers. All problems are sort of opportunities in some way. And do you see any opportunities sort of as changes to your TB work because of the COVID-19 pandemic, something that's going to change your work and something that's going to be sort of here to stay even when the pandemic sort of slows down? Dr. Fisher, would love to hear from you first.
Yeah, I think there's lots of things that we've been able to do quickly that will stay. Certainly, we've been able to institute within 2 weeks. We went from in-person DOT to video DOT. And I think for our patients, especially given travel limitations and expense with travel in the city that I work with, that's been a really exceptional improvement. So I hope that's here to stay. I don't think we're as patient-centered yet as we should, because we're not doing DOT outside of regular business hours, and that's a real struggle for our working patients who really can't be missing their work to obtain their DOT. I think we've worked really hard to streamline our latent tuberculosis infection patients. We had to stop all that work for 2 months and then had a large amount of catch-up to do. So really working on patient-centered latent tuberculosis infection therapy. We know that's the way we're going to eliminate tuberculosis. Patients aren't sick when they have latent tuberculosis infection. They have other priorities that are really important. So making it as easy, as streamlined as possible for people to be interested in testing and treatment for latent tuberculosis infection. And I think, as I just mentioned, really trying to destigmatize respiratory illness, explaining why it's important to wear masks. I think that's one of the really big opportunities for COVID. Often our patients don't want to admit they have tuberculosis. They don't want to have to go out in public when they have to wear a mask. So really trying to destigmatize infectious respiratory illness and why we need to care so much about it, I think is something hopefully we can continue past the COVID-19 pandemic.
Thank you, Dr. Fisher. That was really interesting, and something that the community also feels for largely is, right, the whole stigma aspect of it and how it affects everyone. Of course, it affects women way more than men out here as well. And it's just very different to see how masks are treated when you have COVID versus how they were perceived when you had TB. So it's very interesting. It's going to be interesting to see how this sort of progresses. But I do believe, and I want to firmly believe that, if you're able to sort of destigmatize the whole thing, it'll create a very friendly atmosphere for people to not be ashamed of their diagnosis in some way. So thank you so much for bringing light to this very controversial topic of stigma, something that really needs to be addressed. With that, I would go to you, Luan. Could you share your thoughts on the same question? Do you see any opportunities as changes to your TB work that are here to stay because of the COVID-19 pandemic?
Yeah, I think that there actually has been so not just any, but a lot of opportunities. And I think I had the same topic as Dr. Fisher on here as well, which is the acknowledgement of respect for infectious diseases and the destigmatization of everybody being able to get a respiratory disease like that, and whether it's COVID or TB, among the general population, and amongst not just the people who are affected by it, but also amongst the people who can do something about it, amongst people like policymakers, but also people like private sector company owners and so on and so forth, who can maybe empathize better with what it's like to actually be a person affected by a disease like TB. And so the destigmatization and the acknowledgement of that, and along with that, actually the general acceptance on what Vietnam has done a lot of contact investigation, of health seeking for these type of diseases. I think that COVID has opened up this a greater willingness and hopefully openness to be investigated, or whether or not you had it. And I think because when it was stigmatized, more stigmatized, you would not actually participate willingly unless you had symptoms or were really worried about that. And I think that hopefully will improve the future health seeking once the epidemic is under control. The other points we had talked about earlier, for example, the appreciation or an application of remote and mobile tech. Right? We mentioned a lot of conferencing and telehealth type of activities, and Vietnam was never, and I say never, but it really meant never, was never really a country that did conference calls. Everything was in person, and everything was dealt with around the table. And nowadays, it is completely okay and completely normal to have Zoom calls across the country. But not just in terms of that work, but also a greater focus on technologies like GX Alert, where diagnostic results are just transferred centrally rather than through a paper register, or AI or mobile X-ray technology. These type of things that can reduce the barriers to access and the barriers to information, which I think that actually COVID has contributed significantly to improve for TB, but just in general, for healthcare in general. And I think lastly, I think I just have to go back to this because I do this every time, but it's mentioning COVID and TB along in terms of for advocacy amongst policymakers in Vietnam. And I think I've done it a couple of times now on consensus building meetings, where we say we want to build consensus. And what you do to build consensus, you have to describe the urgency, and you have to instill the urgency of wanting to end TB, and instill the belief that you can actually end TB. And using COVID to say, we've had Vietnam especially, but the world, I think, will get there. Vietnam especially has already shown such a successful response that there's no reason why they shouldn't be able to do that for TB if we know what causes TB, have the tools to diagnosis, have the tools to treat, like cost-effective treatment, and even have the medicines to treat latent TB infection or to prevent it. And plus masks, plus infection control or better ventilation, we have all the knowledge we need to end TB. And if we are dedicated and do the same thing that we do for COVID, we can end TB in Vietnam. And that's the message that I've been trying to communicate on these consensus building meetings with provincial governments, departments of health, or local and even national policymakers, to feel that the urgency is there. More people die of TB than COVID, and we have more tools than we have for COVID. Then why should we not use all that urgency and the tools that we have to work towards ending TB? And I think that's actually the biggest opportunity that we have because of COVID.
Thank you so much, Luan. That makes a lot of sense, right? And something that resonates with, I think, all of us working in this space is, COVID has a drastically different response than TB has ever had. And there are all kinds of tests there, right? Like in India, I think a couple of days ago, I read something like a paper-based test. You get to know in 24 hours if you have COVID or not, and it's based on a simple paper test. You have cough-based tools, like you cough into a mobile app and it tells you if you have COVID or not. I mean, this problem has been here for a few months, and we have so many things already. It's like a basket of options to choose from. And I really, really hope that we sort of repurpose the COVID solutions and bring them to TB, because TB is here to stay. And it's a paradoxical situation, right? While COVID has sort of pushed us, 5-10 years into the future, where now everything's going virtual, people are in conferences on Zoom calls. At the same time, other diseases are taking sort of a big hit and going back 5 to 10 years. The same damage is being sort of done again. So it's a very confusing state. But I think through this conversation that we've had right now, it's very, very clear to me that there is significant damage that has happened to TB services, and there's a lot of scope on the ground to improve the way we are delivering TB care. And we can do so much more, and how we can use this momentum that COVID has sort of built and brought down here to help sort of take care of TB services as well. And on this note, I'd actually like to invite Robyn to share some of the interesting work that she's been doing recently in this context.
Thanks so much, Saurabh, and thank you so much to our panelists for sharing your really important experience, which should feed and drive all of the advocacy that we do in this space, and also feed all of the decision making that decision makers are making in response to both COVID-19 and TB right now. So I just want to pick up on some of the things that everybody has shared and tell you a little bit about an example of where communities are taking action right now, mobilizing with their own resources right now to do exactly what some of our great speakers has talked about, to leverage the interest in respiratory infectious diseases right now, and make sure that tuberculosis does not lose attention from our policymakers, our influencers, and our systems. Because quite frankly, what we've seen is a massive diversion of resources away from responding to TB to respond to COVID-19. And we cannot let that happen. We cannot stand for chronic austerity policies, which means our health systems aren't strong enough to respond to a crisis and maintain business as usual to make sure that the health of their population isn't suffering with all sorts of other different communicable and non-communicable diseases, quite frankly. So I am really proud to have had the opportunity to work in collaboration with a number of different global civil society organizations committed to ending tuberculosis, to come together to get that data from the ground, Daniel, and try and understand how COVID-19 has impacted the TB epidemic. So I'm going to share my screen right now to show you this real life project and explain to you why it's such an important initiative that's happened, and how you as a community and an individual can take this level of action. Okay, so like everyone, we're all freaking out about COVID-19 and what it's doing to the issues and causes that we care about. So we weren't just going to sit by and do nothing. A bunch of organizations, you can see their logos right here, they're all prominent actors in the fight to end tuberculosis. We're all civil society organizations, and we all decided, okay, we're going to come together and pool our resources, because now more than ever, we need our brain to be as big as possible and our pot of gold to be increased as well. We all tend to be chronically under-resourced, but when we come together, we have access to more and we can have higher impact as a community. So we put together a survey, and we wanted to survey the people working on the front lines engaged in the TB response. So that's frontline healthcare workers that usually respond to tuberculosis, TB researchers, TB advocates, program and policy officers, people with TB themselves, to understand what was happening to them. And by coming together and doing this jointly, we were able to get attention to the cause. If Results Canada as an independent organization tried to do this, no one would give any attention to it. You're just one organization trying to do something big. But as soon as you have a lot of voices at the table and a diversity of voice at the table, people will listen. So because we did this project, it's not just about the findings that are really rich, it's about the process in itself. Because we did this as a team, we were able to get the biggest bigwigs in the TB sector to respond to the calls to actions that came out of our research findings. So we had this virtual launch event. You can go watch the recording here if you want. And Peter Sands responded to our calls to action. He's the executive director of the Global Fund to Fight AIDS, tuberculosis, and malaria. We had Dr. Teresa, who's the ED of the TB program at the World Health Organization, respond. We had Madhu Pai, who's like a giant in the TB research sector, responding. So by coming together, we garnered attention and we had them heed our calls to actions. Next step is holding them to account though. So you can go watch that video there if you want. I'm going to share this link in the chat box as well. In this web page, you have access to all of our findings. And we don't just want to create a report that sits on a shelf and goes nowhere. We want these to become tools for advocacy. So you can have an explore here yourself. You can see the full report in different languages, and then also specific sections of the report. I'm just going to click and open the key findings right here. This is a briefing note, 3-page briefing note that just gives the high-level overview of what we found. So a lot of the findings are similar to what our panelists shared today, so I'm not going to go into big detail, but just to note that this is here, and this is a resource for you to learn more, and also to send to policymakers, decision makers, to get them interested in this work. I also want to share right here, if you click on these, we had different chapters in the report for the different stakeholders that we surveyed. And you can read them individually based on your own interests. But within, you can find some really, really interesting and compelling quotes. So for example, one person from TB with Kenya said that, "I'm sometimes rejected by family members because they think I have the same signs of COVID. I'm even thinking of moving from the family." So in some cases, Dr. Fisher was speaking about how COVID has been a good thing for TB stigma here in Canada. But for some people in other places around the world, they're actually feeling a heightened experience of stigma because of COVID-19. So yeah, you can check out the individual chapters. All the data is laid out with our number of subjects who participated in each. Here we had 159 responses of people with TB from Kenya. And really shockingly, 53.6% of them said that they had visited their health facility to seek care for TB during COVID-19, but there were not enough healthcare workers available to care for them. As Dina was saying, a lot of her team has been redirected to respond to COVID. So there's no one there to respond to TB patients right now. So just wanted to share with you that this exists. I'm going to put it in the chat box right now because I'd love you to go have an explore, check it out, engage with this resource, draw inspiration from this resource. Nobody gave us an order to do this. We mobilized and said we need to do this. And we didn't have any money on the table when we first started. The money came after, and as we were going, and hopefully more will come still. Where's the chat box? Chat. I'll put it in the chat box later. Okay. The last thing I want to share is that we also have a social media toolkit. So if you're on Twitter, you can go into the social media toolkit and send any of these tweets at any time. There's a bunch of pre-drafted content right here for your use. And this is how you put together an advocacy toolkit on a budget. You use Google Drive. And yeah, just to show that these are really beautiful graphics with lots of great information that are tools and resources for you to use. Interestingly, off the back of our big global launch, because we had a lot of data coming in from specific countries, we were also able to have launch events in India, Kenya, and the United States. So it wasn't just this one project. We've developed a ton of different resources off the back of this one project, and we're going to keep going with that action. Now we're feeding these results into different fora. So for example, this conference right now, I'm presenting this piece of work to you. The qualitative research questions from this project were the questions that were posed to our panelists. We're also presenting all of this content at the Union Conference, which is taking place right now. It's the big global lung health conference every year. And by getting our message out, we're raising awareness, we're educating, and we're putting pressure on decision makers and donors. Okay, so I have an ask of all of you right now. I would like you to help draw some attention to something that's relevant to Canada and global health, which is TB Reach. I talked about it earlier. If you are on Twitter, I would really like for you to go onto Twitter and send out a tweet right now. Sometimes, you might think that a tweet doesn't do much. But the way that we're sending this tweet today, we're tagging decision makers. We're tagging Karina Gould, who is Canada's Minister for International Development, and we're tagging Development Canada, which is Global Affairs Canada, who deploys all of our resources for international global health and development causes. So when they see the public talking about these issues, they start to pay attention. So it might seem like, oh, it's just a tweet, it doesn't matter, but actually it does. It's an effective tool for getting attention to your issue. So just copy the tweet copy that I just put in the chat box, copy it, go on Twitter and hit send. It's the exact amount of characters you need, and it's calling for Canada to continue its investment in TB Reach, which gets monies to communities who are responding to ending TB. Okay, so we only have a few minutes left, and I really want to leave this on an inspiring high note. So I'm going to invite each one of our speakers to close with some final remarks that they want to leave you with today. And thank you to all of you for participating again. First, I'm going to hand it over to Dina, then we'll go Luan, and we'll finish with Sora. How about that, okay? Closing remarks, Dina.
Great, thanks. I think we've shown with trying to respond to COVID that we can do things decisively, quickly, patient-centered, and well. I just think we need to be careful that we're not promoting any health inequities and continue to advocate for resources that our patients need, including access to virtual health.
Thanks, Robyn. And again, just thank you everybody for being on till now, and thanks for having me on this panel. I think my message is pretty simple. It's, you know, with 1.1 million people that have passed away due to COVID this far, the world's been hit pretty hard. But the same number of people died of TB in 2019, and in 2018, and in 2017, and 2016. And actually in 2020, it's probably going to be 1.5 times that much. So it's probably going to be exceeding what the COVID has claimed so far. So I think it's a critical moment to seize the opportunity and the momentum of this heightened awareness about respiratory diseases and the most deadly, virulent infectious disease in the world, to say to people, you need to end both. And I think I would be remiss not to say that Canada, the country of Canada, and Global Health Affairs Canada has done an amazing job to support the fight against TB over the past several decades, whether it's, you know, the obviously investment in the Global Fund, but specifically initiatives like the Fidelis Initiative and what we've been talking about, TB Reach, like such a critical catalytic mechanism focused only on TB and pushing the envelope, pushing innovation. And I think that it's really, and, you know, I just hope and wish that more countries will follow the lead that Canada has set, the path that Canada has set forth, and make ending TB a priority. And I think that, you know, it's been 10 long months with COVID. It's been 10,000 long years with TB. And I think we need to make sure that we end both. So I think I'll stop here. And again, thanks everybody for listening and for being on this panel. Thank you.
Thank you so much, Dina and Juan, for amazing things that you've just said. As someone who's lived with the disease, I would like to tell you that the patients need us now. We all need to act now. We have to step up our game, make changes in every way possible. You know, every effort counts. So we need to ask ourselves, how can I contribute to this change, and then just go ahead and do it. And patients need us now more than ever. And I'm a big fan of Spider-Man while growing up, and I remember what Uncle Ben told him once, which is, with great power comes great responsibility. So I think to all the countries that can make a difference, you know, if you're capable of change, you're responsible for it. And I hope that everyone starts taking TB as seriously as other diseases. And I'm sure we need to end COVID and TB and do everything we can in our power. And I think I'll stop there. Thank you, everyone. Thanks, Robyn.
Thank you so much, Saurabh. So we leave you now, all of our guests. Panelists, please stay on for a moment. We'll just do a quick debrief. But we leave all of you guests with the knowledge that you as an individual have the power to make change happen. And when you join forces with people that are working towards a common and shared goal, you increase your access to resource and you increase the power and strength of your voice and your action. So please do remember tuberculosis during the era of COVID-19, and let's make sure that all health systems everywhere have the resources they need to be effective and to provide quality services to people, and that we take comprehensive and integrated approaches to eliminating all diseases and ill health. Thanks so much, everyone. Have a great afternoon.